Flat feet. Also known as pes plano valgus and adult acquired flat foot. Flat feet, more commonly known as fallen arches, is a condition found in both children and adults. In most situations, when the patient is non-weight bearing, there will be some sort of discernible arch, however, that arch quickly disappears when the patient stands up. The flexible flat foot that we are going to discuss here may occur in one or both feet, and the degree of flattening can vary between the two feet. Flat feet are common, if not almost normal, in infants and toddlers, simply due to the fact that the arch of the foot has not yet developed. Symptoms of flat feet. What should you look for? Young children. Even though young children will tend to walk flat-footed, their gait should be observed for any abnormal signs such as limping, clumsiness in gait, or an excessive knock-kneed gait. Preteens and teenagers. Usually in this age range, parents bring the children in for treatment of their flat feet because the kids have started playing sports and the demands of a lot of running are now beginning to manifest themselves with foot and leg pain as a result of flat feet. Adults. Flat feet in the adult may either be a direct extension of the condition from youth or can be caused by other factors. These factors include injury, disease such as arthritis or neurological disease, poor biomechanics, a fault in the way the foot functions during gait, excessive weight gain, occupational demands placed on the feet, and hormonal changes seen during pregnancy along with the associated weight gain. Because the foot is overstretching or flattening out, it is putting excessive strain on the muscles and ligaments that hold the foot together. In doing so, it forces the muscles in the foot and lower leg to work in an abnormal fashion, causing a variety of problems. Adult acquired flat foot. A worsening state of flat feet in the adult is known as adult acquired flat foot, medically known as posterior tibial dysfunction. For years the consensus was that this condition was caused by a loss of function of the posterior tibial muscle, also known as the long flexor tendon. In more recent years the general thinking has moved more to a combination of non-function of various parts of the foot, primarily the ligament attachments in the rear portion of the foot. This line of thinking would make sense since surgically repairing the tibialis posterior muscle alone rarely solves the problem. Initial treatment. In the early stages of deformity, when you first experience tendinitis, swelling and pain, simple techniques like ice, immobilization, and anti-inflammatory medication is probably all that is needed. Advanced treatment. In more advanced stages, once the inflammation is reduced through ice and medication, and ankle-foot orthosis may be needed to give better support to the foot. Once a patient presents with a completely broken down foot, conservative therapy will not help. It may offer short-term relief, but ultimately the patient will have to consider surgical intervention ranging from repair of the tibialis posterior tendon, to associated ligament repair, to bone fusions, where certain bones in the mid and rear portion of the foot are fused to hold the foot in an upright position. Read the complete article at www.foot-pain-explained.com/flat-feet.html